Do you have a diagonal crease on your earlobe like this? Many people believe that simply looking at an earlobe can reveal whether someone is at risk of heart disease. Some even call it the heart attack warning wrinkle, especially when it appears before the age of 60. But is that really true? Or is it just another internet myth? In today's video, I'll explain a fascinating medical finding known as Frank's sign and what scientific research actually says about it. Hello, I'm Dr. Tian Tran, an ear, nose, and throat specialist. Today, let's find out whether your ears might be revealing something about your cardiovascular health. What is Frank's sign? Frank's sign is the name given to a diagonal crease that runs across the earlobe. This sign was first described in 1973 by cardiologist Dr. Sanders Frank. He noticed that many of his patients with coronary artery disease shared a common feature, a diagonal crease on the earlobe. This observation sparked an intriguing question among researchers. Could a small crease on the ear somehow be linked to the health of the heart? What surprised researchers is that many studies conducted over the following decades found that people with Frank's sign were more likely to have cardiovascular disease and atherosclerosis than those without it. Sounds hard to believe, doesn't it? After all, the ear and the heart seem completely unrelated. So why might there be a connection? A systematic review published in 2021 analyzed 13 studies involving nearly 4,000 patients who underwent coronary artery evaluation. The authors found that individuals with Frank's sign tended to have a higher prevalence of coronary artery disease than those without the sign. That is why many physicians still pay attention to the earlobes during a physical examination. Scientists believe the explanation may involve the tiny blood vessels that supply the earlobe. When aging or atherosclerosis affects blood vessels throughout the body, similar changes may occur in the tissues of the earlobe. Over time, these changes may contribute to the formation of the characteristic diagonal crease known as Frank's sign. If you notice that you have Frank's sign, don't panic. This crease appears to be more meaningful in people younger than 60 years old. In older adults, it may simply reflect natural skin aging and the gradual loss of collagen. Instead, consider it a reminder to pay closer attention to your cardiovascular health. You should check your blood pressure regularly. Monitor your blood sugar levels. Have your cholesterol tested. Maintain a healthy body weight. Avoid smoking. Exercise for at least 150 minutes per week. However, this is where many people misunderstand Frank's sign. Frank's sign is not a definitive diagnostic sign of heart disease. Let me repeat that. It is only a clue that may suggest an increased risk. It is not proof that you have heart disease. A real-life example, imagine two people who both have Frank's sign. The first person doesn't smoke, has normal blood pressure, has normal blood sugar levels, has healthy cholesterol levels, exercises regularly. The second person has smoked for many years, has high blood pressure, has diabetes, is overweight or obese. Which person is at greater risk of heart disease? Clearly, the second one. This example reminds us that traditional cardiovascular risk factors remain far more important than the presence of a crease on the earlobe. Our bodies sometimes reveal fascinating clues about our health. Frank's sign is one of those clues. It is not a prediction of heart disease, but it may serve as a reminder that it's time to pay attention to your cardiovascular health. Take a look at your own earlobes or those of your family members and let me know in the comments. Do you see this diagonal crease? Thank you for watching. I'll see you in the next video.